This presentation will be addressing the growing issue of obesity amongst children in school, identifying the risks involved, the need for change, and will also provide an action plan in order to combat obesity, not only in our school of Wynnum West State, but also in the wider community. To first address the issue, we must understand its meaning. Obesity is a medical condition in which excess body fat has accumulated on the body to the extent that it may have a negative impact or effect on someone's health. This condition of health may also lead to a reduced life expectancy and increased health problems. In majority of Western cultures, people are considered obese when their body mass index, a measurement acquired by dividing a person's weight by the square of a person's height, exceeds 30 kilograms per meter squared. The range 25 to 30 kilograms per meter squared is categorized by this measurement as overweight. Another commonly used method for the measurement of obesity is measured by waist circumference. Waist circumference measurements that indicate regional fat distribution are increasingly recognized as a useful tool in assessing body fat. This is because abdominal fat is considered more threatening to health than fat stored in other regions. A waist-to-hip ratio greater than 1 in men and 0.8 in women indicates increased health risks. Although there are multiple forms of measurement, it is often difficult to develop one universal and simple index for the measurement of overweight and obesity. This is because of the fact that as the bodies of children and adolescents grow, they undergo a significant number of physiological changes. Although the calculation of BMI in some instances may not be accurate, it is a good way for people to begin addressing their weight. There are many causes that directly and indirectly contribute to obesity. Besides genetic factors, overweight and obesity is caused by an energy imbalance of the body, where the energy intake exceeds energy expenditure over a period of time. Hence, good nutrition and adequate levels of physical activity play an important role in the prevention of further weight gain throughout someone's life. It is generally agreed that this energy imbalance is due to large-scale changes in the modern environment. Society, unfortunately, plays a huge role in influence involving diet, food, travel, and exercise. A few factors that contribute to the obesity in children include the cost of fast food going down, energy-dense foods becoming more easily available, portion sizes increasing, marketing for fast and unhealthy foods increasing, the use of cars increasing, and the role of physical education in the school curriculum being reduced. Although convenient, Wynnum West State School is located on a main road right across from a large shopping centre. With the temptation of easy-to-access fast foods just a few metres away, Wynnum West students are at risk of making a trip to Hungry Jack's a part of their daily routine. However, it is not for us to control what a student eats in their own time out of school, but it is our responsibility as teachers to inform them of the potential risk of their decisions. Statistics show that a staggering 3 in 5 Australians are overweight or obese. That makes up about 12 million people. 1 in 4 Australian children are overweight or obese, and 80% of obese children will grow up to be obese adults. The issue needs to be put forward as early as possible if our school is going to positively impact these statistics. Rates of overweight and obesity are continuing to rise in Australia. Collecting information on these trends is important for managing the health problems associated with them. But why, however, is obesity such an issue? The health problems and consequences of obesity are many and varied. There are more than 40 medical conditions that are associated with obesity. This includes musculoskeletal problems, cardiovascular disease, some cancers, sleep apnea, stroke, high blood pressure, type 2 diabetes, and hypertension, just to name a few. Many of these conditions, however, are preventable through an active lifestyle. Overweight and obesity not only causes physiological problems, but also psychological problems, such as having a negative body image. This may also contribute to more serious conditions, such as body dysmorphic disorder and social physique anxiety. Body dysmorphic disorder involves a concern over one's appearance that becomes obsessive and accompanies a distorted view of one's shape and size. Social physique anxiety is an extreme desire to look good and has a destructive effect on one's social interaction with others. Another consequence that many young obese people face is social discrimination, and this can be based purely on weight. Overweight and obesity's contribution to bullying is plenty of initiative for us as teachers to take some responsibility and address the issue. It is these mental and physical consequences of obesity that make obesity an important issue to inform students about in school, as it affects both their present and their future. Teachers have a large responsibility when it comes to educating children about healthy lifestyles and health issues, such as obesity. It is a teacher's responsibility to provide students with the opportunity to develop their personal skills on the subject, and also to create a safe and supportive learning environment for students. Students do need more incentive than junk food makes you fat. A useful tool in making sure that teachers achieve the overall goal or objective is to use the framework of the Ottawa Charter. This will be explored later on in the presentation. Teachers are trained educators that have been taught to provide students with information objectively. This allows students to make informed, educated decisions based on information that they have received. Receiving education on obesity from educators eliminates any prejudice and biased views being pushed onto students, whether negative or otherwise. Informing students about healthy eating and an active lifestyle allows students to reflect rather than feeling pressured or ridiculed for not having had assumed that lifestyle already. This could also be due to socio-economic or cultural factors. It is important for teachers not to forget that they are a position of authority, therefore a position of influence amongst the children that they teach. Involving all staff in creating a unit plan on health is an effective way to both combat the issue of obesity, as well as initiate discussion and in-depth conversation with the issue. Involving the local community in this action plan is also extremely important, as it involves other avenues of influence. It is important that teachers are also aware of the impact that they may have on a student's level of activity and nutrition whilst at school. More often, teachers are inadvertently taking away opportunities for students to become more physically active and nutritionally healthy. So it is important that teachers are informed and aware of their pedagogy. An example of this would be a teacher's form of discipline. It is unfortunately quite commonplace for teachers within our own community to keep a student back from PE lesson or recess as a punishment for not performing academically or for causing trouble in class. This provides incentive for students to behave and enhance performance. After all, what student would want to miss out on PE or recess? However, this action is reducing the already small amount of physical activity that the students are receiving at school. and also limits a student's time to eat and interact socially with other children on the playground. Overweight or obese children are more likely to remain obese as adolescents and become overweight or obese as adults. About 80% of obese adolescents will become obese adults. Being obese as a child or adolescent increases the risk of a range of diseases and disorders in adulthood, regardless of whether the adult is obese or not. It's important to identify and start to reverse the condition before children become adults. Ideally, overweight and obesity should be prevented. This is why educating students on obesity at such a young age is so important. To create an effective health promotion strategy, it is useful to look at a tool called the Ottawa Charter. There are 5 health promotion acts in the Ottawa Charter, which include building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. Wynnum West has already taken initiative in creating a supportive environment for students, as well as strengthening community action. They have done this by partnering with Manly Pool. Manly Pool works together with the school in supplying family passes so that more families have access to swimming facilities before, after, and even during school holidays. The school also participates not only in athletics, swimming and cross-country, but also participates in inter-school sporting teams as part of a winter school sport program. This not only creates a supportive environment for students, but also strengthens ties with the community. The creation of a universal school health policy would further improve the actions of health promotion in the school by getting everyone involved. This policy could be something similar to Wynnum's current code of conduct. Be respectful, be responsible, be safe, and be a learner. Holding short classes once a week addressing health is a great way for students to explore the subject as an entity and provide a more personal approach. This may involve a lot of discussion, reflection, and input by students. This will give teachers further insight on how they can better address the issue of obesity by first exploring the students' background knowledge, or even lack thereof. Making students self-conscious of their bodies is not the aim. Although obesity is damaging to health, it is important that students are able to identify that a variety of body shapes can be both healthy and normal. In-class activities that develop a student's skills to identify factors that influence their behaviours is extremely important, as it may strongly contribute to their health. This could help combat excessive visits to the mall for fast food. Although reflecting tasks may be a bit concerning and frightening, it is important that they are able to make the task personal. It makes the task more real-life and engaging. However, in order to be able to begin these in-class activities, it is important to establish a strong and respectful relationship with your students and the students amongst each other. In order for students to productively reflect and evaluate, it is important for them to be in a safe learning environment. The main issues within our school involving obesity arise from the lack of education, which includes both staff and students. If our staff are able to educate themselves, create new policy, and incorporate the Ottawa Charter in terms of health promotion, the students of our school will be better able to make healthier choices. This is how we will be able to combat obesity within our school, and this is how we can improve the present and future health of our students.